So let's get started. Welcome to the SADS Foundation webinar in our Living with SADS series tonight on sports and summer activities. I'm Marcia Baker, Program Director for the SADS Foundation. A few reminders before we start. Please keep your audio muted during the presentation. Your video camera is optional. We love to see your faces if you want to turn it on. Following the presentation, we have time for your questions. You may type your question in the chat anytime and we'll address them at the end of the presentation. You may also unmute yourself and ask your question verbally. So it's my pleasure to welcome back our presenter, Dr. Aarti Dalal from Children's Hospital at Vanderbilt University in Nashville. You may remember her as she kicked off our first webinar in our series, What Makes Your SADS Heart Different? It was an overview of SADS conditions about a year and a half ago when we started this process. This overview webinar of the SADS is still available to view in our past recordings if you'd like to view it. At that time, Dr. Dalal was at St. Louis Children's Hospital and moved later that fall to Vanderbilt University. She's been a longtime supporter of the SADS Foundation through her volunteer contributions as an advocate, a committee member, and speaker at our annual family conferences. And she refers her patients often to our SADS.org resources that are available online. So we are honored that Dr. Dalal is volunteering her expertise and time with us tonight. So thank you, Aarti, and welcome back.
Thank you so much. It's great seeing all of you guys today, and thank you to the SADS team for inviting me. I love collaborating with you guys. You guys are an amazing resource for our patients, and it is true. I send all of my patients to your website. So I'm glad. It's exciting to see it being revamped. So it's exciting. It's very nice. And Kelly, it is so good to see you. So it's so full circle. So this is really exciting. So as mentioned, my name is Aarti Dalal. I am a electrophysiologist in Nashville, and I have no real disclosures except I sit on the SADS Foundation's Medical Education Committee. Remember, this is a dynamic and interactive process. So today, sort of going to be talking about how I do this. But I think the really great thing about SADS is that we learn from each other. We love hearing from families and how, if there are things that you are concerned about, challenges, and remember how we are managing our patients with different genetic arrhythmia syndromes is really changing based on one, research, but also as we learn about patients individually and things that they want to do with their life. And this is sort of a good topic to talk about as we move into the summer. So one of the things, or a few of the things that we want to really highlight today, right, is number one, let's not talk about the things our kids can't do, but rather what are the things our kids can do? How do we make being involved in sports and activities healthy for all of our patients? A big topic is ARVC in sports. We'll highlight it a little bit. This is really just in general, all of our patients and what can they do, and then how to encourage safe play really in general. So that is sort of the goal of tonight. And so the easy answer, right? The traditional answer has always been when someone has said, can my child play sports? Can they participate? The easy answer is no, have them do something else. But that's not really where we're going. We want our kids to be involved. We want them to be full children, right? When in school and activities. So how do we get our children there? And so this is, remember, this is interactive. If I could see your faces, I would call on you, but we will not do that. But instead, you get to do this in a very safe environment. So I'm going to use a program called Mentimeter. If you guys can go, we'll just take a minute, go to menti.com, and you're going to put in this code. And I want you guys to type in, why do you think sports or organized activities are important? So we'll just give you guys a second to log in. And then you can just submit. And once you do, it will show up on this page, and it will not be attributed to you. So it's completely anonymous. Oh, thanks, Alice. Is it working for people? Oh, perfect. Good. We'll give it about 10 more seconds, give everybody a chance. If you are unable to, you need another minute, just either raise your hand or do some type of emoticon on Zoom, so I know that you need a second. But we will use this in future slides, so don't lose the website. So exactly, for all of the reasons that you guys have listed, it is important to make sure that our kids are involved in organized activities like sports. And I think you guys hit on a lot of them. So there is true physical benefits, right, for being active, healthy lifestyle. It's been shown to result in better academics, the social aspect, the leadership development that occurs, being part of a team, being able to understand how to be part of a team, following rules and understand that you can't always win in life, right? We all get that now. All of us are getting trophies. It's important to understand that the things that you learn from being part of a team, things like resilience. So for all of those reasons, we want patients to be involved in sports and activities. And I think Robert Campbell sort of gave a presentation like this before. And remember, the goal of what we're doing is not to have our children just survive, but we want our children to thrive. And that is, we want them to be complete people. And so when we talk about, and you ask your provider, can my child do X, Y, or Z? It really is taking the objective data and using a shared decision-making model, coming up with a plan. And I'm really going to highlight this throughout the presentation. So I don't want, and I'm reading names here, so please don't think that I'm calling anybody out. But since I know Kelly, I also will call her out. And she smiled, which means I'm allowed to. So what we decide for Kelly is not going to be the same thing that we decide for Kayla or Jess or Michelle or Stacy, right? It's going to be based on what your child's diagnosis is, the conversation you've had with your physician and their school and their coaches, and that ultimately will be the decision that is best for your child. And so it's balancing safety with the quality of life. So I'm showing this slide only to tell you, not that we're following 2005 guidelines or 2015, but rather just to say that this is evolving. And so how physicians have really approached patients with specifically inherited arrhythmia syndromes it used to be very strict. And if you talk to physicians today, maybe physicians that may not be as tightly partnered with the SADS Foundation, they still might be very strict and they might follow some of these guidelines to a T. So a lot of times, I will tell you, is when physicians make recommendations of allowing you to do things, it is going off guidelines and recommendations. But we also know guidelines and recommendations tend to lag behind to the science. So making sure that you're up to date with what is happening and using the SADS website as that resource, because they are very intimately involved with researchers in the field, and they know what's happening and also are up to date with what is actively being published. So I put this here to tell you, if your physician is not maybe making the recommendations that you want, it might be that they're basing their recommendation on guidelines, but know that it is fluid. And so I also put this slide up to tell you that how we define activity is also based on the amount of work or intensity it requires. And so there's lots of things that your child can do. So if your child has decided that they want to be involved, be a triathlete, but they have ARVC, it might be, we can say that you can do maybe part of those activities, but let's also find other things that your child can do so they can be involved and not sort of completely remove them from activity. So there's lots of things. And so this truly is about, when we think about shared decision-making model, I want you to think about what your diagnosis is, making sure that you are appropriately risk stratified. And then this circle, the third circle, which is shared decision-making, truly is the most important. You need to clearly outline what you, when I say you, I mean your child, it can be you as well, want out of sports, right? Do they want to be, do they want to go to college on a sports scholarship, for example, or do they want to do recreational activities? And then making sure that, one, you know what your treatment is, but you're being adherent to that treatment, which is then going to get you to that goal. So it is, as I mentioned, a fluid process, but number 3, which is shared decision-making, is truly vital. We are no longer doing paternalistic medicine, right? It's not, I'm going to tell Kelly she can only do X, Y, or Z. Kelly's going to say, you know what, Aarti, I really want to be able to participate in these things. So let's talk about it. And that's really how we should be making decisions about your care. All right, so let's do our next Mentimeter, which is your child, or if it's about you, engaged in organized sports? So go to the to menti.com and put in that same code. It's really exciting to see everyone's names, and mostly I love mom's iPhone. I think it's great. All right, there are only 6 responses and there are more people. So you don't have to, but we'll give it one more minute in case you need a second to log on. Okay, well, I am super pleased to see that nobody chose, no, we'd like to, but our physician has advised restriction. It means we are moving in the right direction when we're talking about participation in our patients with inherited arrhythmias or genetic cardiac diagnoses. All right, next question. What kind of activities are your child involved in? This is another one of those, you get to type it in and we create a nice word cloud. Dancing is great, super fun. Gymnastics, softball, golf. This is excellent. So our kids are involved in everything. Sailing, how fun is that? Maybe they can take me sailing. I'd love to go. So this is awesome. I'm glad that people are participating in a variety of activities and really making sure that we're getting our kids involved out there. So the question, right, is can you participate safely? And the answer is yes. It sounds like people are able to do the things they want to do. And the answer, right, is you need a plan. And so let's talk about what that means. Making sure that, one, you have engaged with a medical team that has done a comprehensive risk stratification, and then optimizing the treatment plan for your inherited disease, and which is independent of whether your child wants to participate in sports or they do. And then understanding what the patient, you or your child, what they want to participate in. So what's the level of sports that they want to do? What do they want to do? and then making sure that everybody agrees on the decision to return to sports, and then also making sure the people that will be around your child during that time. So that means coaches, if there are team physicians, athletic directors. Oh, I don't know if that hyphen was there because it was, I apologize. That was a split line earlier. And then making sure that you know how to enact an emergency action plan. So having an AED around, if it's not your AED, knowing exactly where it is based on where they are going. So let me sort of highlight this return to play model, which we will talk about in a study that was recently published. So I want you to know that the initial evaluation is never just going to be a one-time, right? You're not going to go see someone and say, okay, this is your diagnosis, thank you, have a nice day. There is going to be a comprehensive evaluation, which involves lots of testing, multiple consults sometimes, and it involves baseline EKGs, what happens when you exercise. So that's going to be to mimic that, things like a stress test, non-invasive monitoring like a Holter monitor. And then based on those results, you and your medical team will come up with a customized plan. During that plan, you guys will discuss what are the goals, what do you want, how do you want to participate in activity, and making sure that you are aware of current guidelines and recommendations like beta blocker use, etc. And then having age-appropriate decisions made by parents, or when the child is old enough to make their own decision, by the patient. And then coming up with a return to play model where people who are going to be involved in your child's life know what's happening. So we never want to sort of spring the fact that we have a patient with inherited arrhythmia that's going to be on the team, making sure there's a safety plan. But then if you look at this, sort of the last two lines, it's not about saying that I'm going back to activity and then not going back to the medical team, right? You're going to make sure that you're keeping appointments, you are staying on the medications that have been recommended, and then continuously reevaluating the patient's risk profile and treatment as it may change. And so recently, just last year, there was a retrospective single center study that looked at patients with long QT syndrome, and over a 20-year span, looking at almost 500 patients, long QT patients that were given a return to play approval. And they looked at what were the outcomes. Were these patients at risk for a cardiac event, a life-threatening event while playing sports? Now, mind you, these are patients that had to follow the model that I just showed you, where they were evaluated, they came up with the plan, they were adherent to treatment plans, which included things like beta blockers. And the outcomes of those patients were reviewed. And they found that in about over a 1,200 athlete year follow-up, so 15 patients with long QT had at least one non-lethal breakthrough cardiac event, but that translates to a 1.16 per 100 athlete year risk. So that is very low. So which means that patients with long QT syndrome can safely return to play after a comprehensive risk stratification, making sure that we are providing phenotype specific treatment, and then implementing a proper athlete return to play plan. And so the point of this study is to show that patients can return, even patients that we used to restrict can safely return to play at a fairly competitive level with low adverse events. So again, even though current guidelines may recommend against it, new data continues to come out that supports your child, specifically in this case, long QT syndrome, to be active. I know that people had asked ahead of time about ARVC. Now, I put this up only to say it's also important to remember where you live, right? So guidelines vary based on location. So European guidelines versus US guidelines. And ARVC has often been you can't do anything, very strict guidelines. I want to also tell you, for this patient population, research is actively happening. We know that chronic high intensity activity can exacerbate disease progression, but that doesn't mean patients with ARVC are not allowed to do anything. They should still be involved in a healthy lifestyle, which means participating in activity. And so this study that I am referencing basically looked at what can patients with ARVC safely participate in? How much activity are they allowed to do without increasing their arrhythmia risk? And so people know about the ARVC risk calculator. And so you're looking at sex, age of presentation, things like syncope, whether they have, number of PVCs, et cetera. And when they compared, is an athlete's sort of participation itself part of the risk profile? And the answer is no. But what can athletes do? What can patients with ARVC do safely without increasing their ventricular arrhythmia risk? And essentially, what they found was as long as you are sort of around that 15 METs per hour per week, you aren't increasing that risk. So if I were to ask any of you guys on the call, what does that actually equate to, right? It's hard to sort of understand what that means. And so if you look at what all of these activities actually require, like how many METs, if you're doing high intensity versus lower intensity, it's the things that we identified on that slide earlier. So obviously the higher intensity activities, things like competitive cycling, cross-country skiing, right? If you're going to be a triathlete, those are going to require a lot more metabolic activity. But that doesn't mean you can't participate, or your patient with ARVC can't participate in organized sports. So doing things that may be a little bit less intense. If you think about how that applies to real life, right? We are expending energy when we do anything. And so we want our kids, even with ARVC, to be participating in activity. Nobody should be leading a sedentary lifestyle, and nobody should become sloths. And so sort of limiting it to around that 15 is recommended. And so this is basically how much energy you're expending if you do about 30 minutes of activity, soccer, for example, dancing, golf, volleyball. So these are sort of those numbers. The SADS team asked me to sort of not forget about Brugada patients. So remember, with Brugada syndrome, is there anybody? Oh, I don't. If you have, you can do a little hand. But with Brugada syndrome specifically, there are no exercise restrictions. Remember, one of the risks, for example, is sort of being febrile or sort of heat. So just this goes for everybody, making sure that you're being mindful. I think someone was in Texas, so it's hot down there. Just making sure you're avoiding overheating, things like heat stroke. So I don't have a formal slide for questions, but any questions about the things that we've talked about thus far, or we can save questions at the end. Marcia, Alice, Genevieve, you tell me, should we wait for questions at the end?
I think that would be fine. I haven't seen any come through yet, so.
Okay. So tell me what your summer plans are so we can address them, because truly this is about, can patients participate in sports, but also what about summer safety as we go into the summer months? Someone's in the Bahamas, I saw. So I don't know if that's a vacation thing or if that's Shantae, are you from the Bahamas, or are you just are you on vacation? Because if you live there, then we are going to have our next SADS event down in the Bahamas. Excellent. Thanks for joining, Shantae. So nobody has summer plans, or is nobody engaged in the? Judy, thank you for showing your face. I appreciate it. It's good to see you. This is excellent. All of these activities, traveling, boating, swimming lessons, splash pads, hiking, all of these activities are things that we want to encourage and all of your kids should be doing. Excellent. You guys have good summer plans. I'm going to be joining some of you. So when we talk about summer safety, and this sort of extends to everybody, number one, if you are going to be traveling internationally, make sure you discuss your plans with your physician. And the reason is, right, it's about making sure that you know how to ask for and get help if you need it. When you're home, you know exactly what numbers you're going to call. You know where to get medication refills. So really, it's just about being prepared. Make sure you have your medications. Make sure you have enough refills available. Know how and where to ask for help. For patients that may have know if you're going to be participating, like if you're going to the pool, make sure you know where the AED is. For patients that have ICDs, I bring this up because I've had some patients that have had this experience. If you are in a pool that may not be electrically grounded properly, I've had patients that have had inappropriate shocks because of that. So again, that doesn't mean you can't be in a pool. Just understand what potential risks may be, but your child can still participate. I think one of the things that we've often talked about is about activity and sports in general is making sure that there is a buddy system or a safety plan, right? So having your child sort of say, I'm going to, do a long trail run by myself and they are a CPD tier, that's probably not the best idea. But still allowing them to participate in activities where they are going on a trail run or going on a hike with other family members is a great idea. Traveling to the bottom of the Grand Canyon where there's no cell reception, probably not a good idea. But knowing that you can ask for help easily, doing things like that is something that we want to encourage. So again, can your child go to summer camp? Sure. Making sure that you have a safety plan in place, just like you would do during the school year, is really ultimately very important. So again, I put this up here and there's a lot of probablys, and that's only because I'm not going to make the decision for you. I don't want you to come onto this webinar and say, well, Dr. Dalal said that I can do everything, so have a nice day, right? It's truly, you're going to have the conversation with your medical team, making sure that you are adherent to the medications that have been recommended, and then you can safely participate in these activities. And so I think roller coasters came up. You can participate in you can ride roller coasters as long as you are able to participate in other activities. You're taking your beta blockers. You're making sure that your adrenaline surges have been well controlled. If you have an ICD, you want to make or a pacemaker, you want to make sure that things that might go over the chest or in the abdomen aren't actively hitting the device, because that could injure the device. So it's about picking the activities that will be safe. But yes, going to theme parks, amusement parks, all of those things. Enjoy your summer. Let your child enjoy their childhood, right? And so that is truly what we want our patients to be able to do. A couple last sort of summary slides, which is don't get frustrated. If you talk to, let's say Shantae talks to Michelle and their child has the same diagnosis, but Michelle and Shantae's plan might be a little bit different. Understand that your physician or your doctor or your medical team really do have your child's best interest at heart. And if it's not the plan that you want, talk to them. Say, this is what my kid really wants to do. And this is their goal. And together making that decision, making sure you can come up with that plan safely is truly where we want you guys to go. Knowing where to find an AED, or that a lot of families have purchased their own AED. That's something you can do, but if you can't afford it or you don't know how to get it, number one, talk to the SADS Foundation. Our team their team is great about sort of making sure that you can get one if you want one. They partner with Project Atom. And so again, knowing how to get the resources that you want, important. And truly, it's as we're learning more about genetic diseases, about the risks, but more importantly, as we learn more about you specifically, the things that your child can do will grow. And then this is from an editorial that sort of reflected on that article that I talked to you guys about, which is patients with genetic arrhythmia syndromes live long, healthy lives, right? And we want them to be able to live, we want you to be able to live your best life. The purpose of sort of treating you is not to sort of make you have a really sedentary, unhappy, and lonely life. It's allowing you to participate in everything that you want to do to the fullest. And so coming up with a plan, working with your physician and your medical team is how you get there. And so the answer to most things that you want to do should be yes, if you are following the recommendations and we are coming up with a safety plan to get you there. This is my contact information. If you ever need to contact me, please reach out. The SADS group, the SADS Foundation know how to reach me at any time. So you can also reach out to them if you want to speak to me outside of this webinar. And I'm happy to chat with anybody. Okay, I think we're going to open it up to questions now.
Thank you so much, Dr. Dalal. And we have a question now from Mom's iPhone. How, where to purchase a personal AED? And
so I'm just reading through. Yeah, so there are, so depending, and yeah, and you're right. And so sometimes insurance has denied it. So if you reach out, it varies a little bit based on essentially where you live. There are some hospitals that have partnered with different groups and they will help provide one. There are, I think someone said there's like the AED Superstore. So those are great resources. You can also reach, if there's a local like Project Atom in your area, you can reach out to them. But really starting out with your cardiologist will be very helpful. And then Marcia, Genevieve, Erin, Alice, do you guys have anything else to add?
I would add that we are going to be doing a SADS live program during CPR AED Awareness Week on, let's see, it's the first Friday in June, right, Erin?
So it should be on June 10th, and we're extending it a little bit longer, and we'll be joined by Ashley Sylvie, a guest from LifeShore, to talk about AEDs and how to obtain one. So if you just follow us on our SADS Facebook page, Twitter, or YouTube, you can watch that and ask questions how to get one through them.
Thank you.
And your cardiologist should be able to, sometimes they are denied, they can usually write a letter and say this is why it's indicated, and that might help. But reach out to your cardiologist. I've written a lot of these letters.
And LifeShore, who will be our guest on SADS Live, can help as well with our families. So here's another question, Aarti. My daughter is 11 and has long QT syndrome. She is not on beta blockers. Her cardiologist determined years ago that it was safe to wean her off. Is this something I should push to revisit now that she's playing sports?
Yes. Is that from Shantae? Perfect. Yes. Sorry. I like to, as Kelly knows, I like using names. So if it makes anybody uncomfortable, just say, stop calling my name and I will. So yes, Shantae, if your daughter is playing sports, I would, again, it depends on what type of long QT she has as well. Long QT syndrome she has. So again, just talk to your physician, make sure that they know that she is active in sports. Find out, make sure that, risks and things haven't changed, because again, based on the type you may have, there are during puberty, etc. All of those things can change as well. So yes, speak to your physician. Any message.
Okay, another question. An adult with long QT syndromes, are half marathons safe?
I would say I would do these two things. Number one, make sure you're taking your medication. Make sure that you've talked to your cardiologist about this. And as long as you've sort of done an appropriate risk profile, right? You've done your stress test, you've made sure that you are otherwise well controlled, you should be able to participate in things like marathons. But again, right, you need to make sure you have a running buddy. There are actually, right, there are people in halves and full marathons, like first responders. So if you go down, they know how to keep you safe. But yes, if that is something that you want to do in your life, as long as you are following your physician's recommendations, you're on your medication, and you are continuing to get followed with it, and you're going to have intermittent stress tests during, during the intervening years, then yeah, you should be able to participate in marathons or half marathons.
Thank you. So Michelle asks, at what age would you first administer a stress test? Her son has long QT type 2, is about to turn 3 years old, and she anticipates registering him for sports in the coming year. Should she request a stress test before he starts sports to see how his heart reacts to consistent running, or is he too young?
Great question, Michelle. So I typically do not, I consider competitive or athletic sports at the point where when the child wants to stop and their coach says keep going and keep running, and they feel like they're unable to, right? At 3, I remember when I did soccer at 3 and my coach was like, hey, keep going. And I was like, yeah, I'm going to sit down right here and like play with the grass, right? So at that age, you don't need to do a stress test. And they also, it would be very difficult to sort of get a 3-year-old to do a stress test properly. So typically stress tests aren't administered before the age of 8 or 10. At 3, your child can participate in whatever. What were you going to do? Soccer, something else? What were you going to do, Michelle?
Yes, most likely soccer in the beginning.
Yeah. So your son can 100% participate in soccer. I think it's important that, again, you can just let the coach know. And the reason, right? So what the question is, why at this age is it important to let a coach know? The biggest reason is kids will fall, kids will trip, right? Sometimes they just want to lie in the ground. It's important that if your child is doing something, we need to not have people assume they're just doing normal child things where they're distracted or they're just like sort of hanging out on the ground. So it's important to let your coach know that, yes, my kid has long QT too, but let him play, let him run, let him do whatever he wants. Really should have no restriction. But he is following with his cardiologist. He's getting, he's getting EKGs, all of those things. So 3 is a little bit too young for a stress test, and let him play and have fun.
Thank you. That was helpful. Thank you.
Thank you. A question from another guest. Hello, I have CPVT and I'm very anxious since I got the diagnosis, but want to go back to skateboarding. Can I?
Yes. So number 1, so I'm not sure who did they, I don't recall them out.
This was from a former question from our SADS
got it.
program.
Okay. So yes, you can, but right, it's the same as every other answer, which is if you have CPVT, you better be on a non-selective beta blocker. And then your physician will do testing to make sure that you are adequately controlled on that beta blocker, and then you can participate in skateboarding. So it's about, again, mitigating risks, but you should be able to go back.
Okay, thank you. Let's see. From Facebook this afternoon, what other conditions can cause kids to faint during exercise?
Sure. So there are lots of things, right? So when we talk about kids fainting sometimes can be benign, right? It can be something where they may they finished exercising and they were a little bit dehydrated, but that's not what we're talking about. We're talking about what kind of conditions can make kids faint that is actually serious. And so if you have a known genetic cardiac disease, right, for all of those reasons, but there are things like, so we talk about channelopathies, we talk about myopathies, right? You can also have different arrhythmias. So not only ventricular arrhythmias that are what can lead to a cardiac arrest, but things like SVT. So lots of different arrhythmias and cardiomyopathies and channelopathies are the ones that we worry about. But that doesn't mean our kids, and I say our kids, the ones that we sort of just identified, can also faint from the reason other kids might faint, right? So if you are dehydrated and you are not keeping up with your volume, you can become faint because your blood pressure is low, for example. So you still have to follow all of sort of the preventative maintenance and guidance that we tell every child, regardless of whether you have an inherited arrhythmia or not. So as you move into the summer months, making sure that your child's well hydrated. I know for a fact that I personally don't drink enough water. So get them a cool water bottle and make sure that they are finishing, you pick, the number, say finish 4 of these a day. I don't care, but give them things, if they are poor water drinkers, making sure that they are staying hydrated and making it into a game. But normal things can also cause your child to pass out. So hydration is important. Patients, again, these are non-inherited arrhythmia reasons, but things like anemia, etc. So lots of other non-cardiac reasons as well. But we are talking about sort of the faint in our patient population, which is very different.
Okay, thank you very much. Here is a question from our SADS Live program from Brianna. She's a long QT type 1, asymptomatic, 40-year-old female. She's on Nadolol. Her question, how do I know that I'm on the correct dosage? For instance, during exercise, how high is too high for my, quote, new maximum heart rate?
Yeah, great question. So we use a lot of sort of surrogates. So there is around like about 1 milligram per kilo, right, is a pretty good dose. But so around 60 milligrams is 40 to 60 milligrams is a good Nadolol dose in adults. But you also, as mentioned, some people may need higher, but it's about trying to sort of, we use heart rates as a surrogate to see if you're being adequately controlled or blunted. So around 150 beats per minute when you're active, right, is a sort of a good surrogate. Now, some people will get higher, athletes who are sort of quite conditioned and might be really competitive, may get a bit higher, but in general around 150, right? If you're just sort of doing like a nice jog or something, or if you like run a couple miles, it's a good number to sort of, we want to have you blunted around 150. I will tell you, athletes also don't love that, right? So if you think about what they need to do and how they need to perform, a lot of athletes will complain about the way they feel on beta blockers. But that is sort of the conversation that you're having with your physician, meaning how do we keep you protected when you are doing the things that you want to do? So you sort of, it's that give and take. So making sure that you are on adequate beta blockers to keep you safe. And we'll also do things like Holters to watch for ectopy, etc., to make sure that we are adequately blunting you as well.
Okay, thank you. And here's a question that came from Facebook this afternoon. Can anyone tell me about running and working out after denervation surgery? I hate running on a beta blocker, but figure the surgery will feel the same during exercise or worse, only it will be permanent.
Yeah, so denervation therapy is something that we do offer to our patients, our CPBT patients, our long QT patients, and you may not need as high of a beta blocker dose. I will tell you, and this is, remember what I told you about making sure you have this conversation with your physician and continually risk stratifying. And so you may be able to lower your beta blocker dose. Depending on how well the outcome of the surgery is, you may be able to be on a fairly low dose, but you also may have a physician that is uncomfortable with you being on 0 beta blocker. There are certain groups that are doing a lot of denervation therapy, and they have a lot of good data that shows that you can be safe after denervation therapy and on a lower dose beta blocker. But again, we need to make sure that you specifically are being evaluated for that. So if after you've had it, you are still going to see what your QT interval is. You're going to have a stress test. You're going to have a Holter monitor, and looking at all the results of all of those, like all of that testing, and seeing how it and what it looks like now. So you may still be on a lower on a low dose, but I don't want to say you're going to be on 0 because it depends. Did I answer your question? Yes.
Yes.
Okay.
Okay, here's one more from Facebook. Let's see. No, this is from mom's iPhone. We have a couple here. 20 milligram daily. Let's see, is it CoreGuard? CoreGuard 20 milligram daily. Blood pressure tends to run low, so did not go with the 40 milligrams. I'm often tired and fluid retention now. Let's see. I often am so tired and fluid retention now. Is this from the beta blocker?
Yeah, so beta blockers can cause people to be a little bit fatigued. I'm not sure if this is a new medication. Sometimes it does take a couple weeks to sort of readjust, but some patients are just sensitive to beta blockers and may feel more fatigued than others. So yes, that is not an uncommon sort of side effect when people start to express intolerance to the medication. And so if that is how you're feeling, and even on a fairly low dose, that's when you want to talk to your physician about, are there other things that you can do from a management standpoint, right? So I've sometimes readjusted medications or done less than ideal beta blockers for patients who are having a lot of side effects with the non-selectives. But again, then the conversation you're having with your cardiologist is, what are the activities I'm going to do? How can I modulate my activity if I am unable to take the level of beta blocker that I need to keep me safe? That's when things like sympathetic denervation therapy can be sort of brought into the conversation. So if you are on a beta blocker and you're just like, listen, my quality of life is awful and I can't even, I'm in a brain fog and I can't do the things I need to do, right? That's not a sports question. That's just how's my quality of life going to be what it needs to be for me to be a normal person again. So mom's iPhone, I would encourage you to speak to your physician. And if it is you, right, I will tell you something. As a medical community, we are still getting better about having this conversation where you say, this is how I'm feeling, and I need you to think about alternatives, versus me saying, here's your prescription, go and have a nice day and let me know what, come back in 6 months so we can refill your medication. So this shared decision making isn't just for sports. It's about your daily activity and your daily life. So please have that conversation with your physician.
Okay, Shantae asks, it sounds like people are more often than not on meds, even if they're not symptomatic. As previously mentioned, my daughter is not on meds. Is this abnormal? I do not know what type of long QT she has, but her cardiologist has not mentioned it.
Yeah, so again, so Shantae, number one, I'm so sorry that that you're nervous. You should feel free to reach out to me, reach out to the SADS team, and making sure that you feel like you're being adequately supported. I do want you to, and we're happy to sort of help frame questions that you can pretend are coming from you, so you can ask your physician this, because you truly should know what type of long QT your daughter has, because that's part of that risk stratification. Knowing what type of long QT your child has will allow you to understand what risks may increase, or what things might increase the risk of arrhythmias and things like that. So again, again, I don't mean to make this generic, right? But it does depend on what type of long QT syndrome your child has. But yes, most patients with long QT syndrome are on medications. Again, long QT type 1 is really the most common. So a lot of those patients are phenotypically will have abnormal sort of EKGs. We put those patients on long QT. Again, I don't know what type your daughter has. If you want, you and I can sort of work through that. Genevieve, Marcia, Aaron, Alice can sort of help find, work with you and your physician to sort of get some of that information. And then I'm happy to sort of support you as you start making decisions for your daughter.
Okay, that's our last question. Dr. Dalal, thank you very much. We appreciate your time. And Shantae, yes, please. All right, we'll work with you, Shantae. We can do some emailing. All right, so we appreciate everyone joining tonight. And thank you most, Aarti. We appreciate your time tonight. And I know you have another meeting to head to. So we'll say thank you and good night, everyone. Have a good rest of the evening.
It's my pleasure. Have a good night, everybody. It's good seeing you guys. Bye, Kelly.